Heart failure is the second leading cause of heart disease-related death in Arkansas. That's according to the Department of Health. But a new monitoring device implanted into the heart is hoping to change that. Channel 7's Matt Mershon is live outside the Heart Hospital tonight to tell us what the device actually does.
Good evening, Scott. The device monitors the pressure in the pulmonary artery. That pressure is usually a good indicator for worsening heart failure. And just a few weeks ago, the first CardioMEMS device to be installed here in Arkansas was implanted in a patient here at the Arkansas Heart Hospital.
The device isn't much larger than a few millimeters, but what the CardioMEMS monitor does, doctors at the Arkansas Heart Hospital say is immense.
I think of it as an early warning system of worsening heart failure, which we have a really hard time with some patients who wind up coming again and again to the hospital.
In fact, nearly 20 to 25% of patients discharged from the hospital with heart failure will readmit for heart failure within 30 days. The device is implanted into the heart with minimal invasion via a heart catheter and placed in the pulmonary artery. There it measures artery pressure. Cardiologist and director of the Congestive Heart Failure Clinic, Dr. Michael Huber, says that pressure is a big indicator.
If the reading is getting lower or staying stable, then we know the patient's doing pretty well. If it starts to increase, then we know that the patient is having worsening heart failure.
The CardioMEMS device reports to an online database, and nurses at Arkansas Heart Hospital's Heart Failure Clinic are keeping a close eye on it. If the numbers don't seem right,
I can just give them a phone call and see what's going on with them.
Skipping a potentially unnecessary trip to the hospital.
Now, the device is only able to be used in certain patients with higher levels of heart failure, but doctors say it can be a lifesaver. Scott?
Always amazed at what those surgeons can do. Thank you, Matt.